Welcome to this overview of the main neck incisions and their corresponding surgical applications. We will explore the common types of neck incisions used in surgery, highlighting where they are made and what procedures they facilitate. First, let's look at the transverse cervical, also known as Kocher's incision. This is a horizontal incision made in a skin crease of the lower anterior neck, typically about 2 centimeters above the suprasternal notch. The Kocher's incision is commonly used for procedures like thyroidectomy, parathyroidectomy, and sometimes for laryngectomy and tracheostomy. Next is the vertical midline, or median, incision. This incision runs vertically down the anterior neck, starting from the suprasternal notch. It is often reserved for urgent procedures, such as emergency tracheostomy, as well as esophagectomy and draining neck abscesses. Now we move on to specialized incisions designed for laryngeal and neck dissection surgeries. The transverse tracheostomy incision is a specific horizontal cut located precisely to align with the second and third tracheal rings, used for both elective and emergency tracheostomy. McPhee's incision is a low, curvilinear cut extending between the sternocleidomastoid muscles, crucial for total or partial laryngectomy and extensive cancer dissection. Let's explore incisions that focus on the upper neck and mandibular region. The modified Blair's incision starts near the ear, follows the posterior margin of the jawbone, and then extends horizontally into the neck. This approach is vital for parotid gland removal, mandibular surgeries, and neck dissection for metastatic cancers. We'll now look at incisions designed for the most extensive neck surgeries. The hockey stick or apron incision is a combination of transverse and vertical cuts, creating an apron-like shape for wide access. It is used for procedures requiring bilateral access, such as bilateral neck dissection and total laryngectomy. Finally, let's cover a couple of other highly specialized surgical approaches. The carotid endarterectomy incision is a vertical cut along the front border of the sternocleidomastoid muscle, specifically for cleaning plaque from the carotid artery. The anterior cervical approach uses a transverse incision parallel to the clavicle, primarily for anterior cervical discectomy and fusion, or ACDF. The wide variety of neck incisions demonstrates the surgical precision required to address diverse anatomical structures and medical conditions. Thank you for watching.